It's been a long road, but there's light at the end of the tunnel. This final module looks at the last steps required to bring your device to market in Brazil. The final leg in getting your device to market in Brazil is registration. Let's take a closer look. With your technical file in hand, it's time to submit your registration application to Anvisa. Once approved, a registration number is issued. You'll also have to appoint a qualified distributor before you can begin marketing your device. Your Brazil registration holder submits your device registration application and all associated documentation to Anvisa for approval. It's important that all documentation be submitted in Portuguese. When approved, Anvisa issues you a registration number and is published in the Diário Oficial da União, or DOU. At this point in the process, the only thing that really stands between you and getting your product out for sale is time. Due to a backlog of applications awaiting review by Anvisa, this portion of the process takes the most time. Depending on the classification of your device, you could be waiting as long as 5 years. Most of the lower-risk devices, however, take much less time. Now that you're finally approved to sell your medical device in Brazil, you'll need to appoint an approved importer distributor. It's important to note the distinction between international and domestic distributors. To avoid complications with Brazil customs, all information pertaining to international distributors must be included in your technical file. This is not necessary for domestic distributors, but it would be in your best interest to verify they are fully qualified. For example, Emergo Brazil requires domestic distributors to provide numerous credentials, including, but not limited to, an AFE operating permit, sanitary operation license, and many others. Now that you've successfully brought your device to market in Brazil, you have to keep it there. This means maintaining your device registration by performing a number of vigilance exercises to maintain your product's quality. As mentioned earlier, Anvisa usually inspects your quality management system every 4 years, and you must perform your own audit during alternating 2-year cycles. You'll also have to renew your Anvisa registration and Inmetro certifications every 5 years. Post-market surveillance helps you monitor any complaints about your device. It also helps you to continually assess the performance, safety, and effectiveness of your device, as well as proactively address any potential problems your device encounters on the market. That brings us to the end of this module and this series on bringing your medical device to market in Brazil. In this series, you learned that Anvisa is the governing regulatory body. We looked at how to determine your device classification and the differences between classifications. We also took a look at the quality system requirements. We then examined the technical file and what documents must be submitted. We also learned that if your company is outside of Brazil, you're required to obtain a Brazil registration holder. Last, we discussed the final steps for device registration and the importance of maintaining device registration after it's on the market. We hope you've enjoyed this video series and learned some valuable information. This is just the tip of the iceberg, though. A wealth of resources including regulatory charts, device regulations, videos, white papers, and more are available at our website, www.emergogroup.com/Brazil. Bye for now.